Hey everyone! So today we are talking about interprofessional practice and education. Specifically, what are they and what are some of the different terms and definitions that are used to describe these two terms? And as some of you may have noticed in your own experiences, there are a lot of different terms to describe interprofessional practice and interprofessional education. And these terms are often used interchangeably despite being distinctly different interventions. But before we delve into that, let's talk a little bit about why this matters. So in my IPE course this week, for those of you who are in my course, we are reading an article by Van Hoof et al. On interprofessional education. And this paper is part of a larger study that we did looking at terminology in continuing education. Specifically, we were aiming to address the misuse and lack of clarity surrounding a lot of commonly used terms for continuing education interventions. So for this project, we developed a methodology for clarifying terminology, and then we applied it to 4 pretty commonly used interventions within continuing education, with interprofessional education being one of them. Although IPE in and of itself is not limited to just continuing education, it can also be used for pre-licensure learners. And the reason why we were concerned with this confusion and lack of consistency surrounding terminology is because the lack of standardized terminology makes it very difficult to evaluate continuing education interventions. And the inconsistencies in the terminology and the different definitions for these interventions can impact our decision making as educators and as researchers. And one of the things we found when we were reviewing the literature is that there are many authors who have expressed the view that having accurate, complete, and consistent descriptions of educational interventions is required to advance the field of continuing education. And this is a pretty substantial problem within the interprofessional education and practice field itself. As you may have noticed from your own past experiences, and even through just reading people's introductions last week in our course, there are a lot of different terms that get used when we're talking about interprofessional interventions. And before we go on, I invite you to pause this video for a moment and just take a minute to reflect and write down some of the different terms that you have heard or seen being used to describe interprofessional education or practice. And a scoping review by Scott Reeves et al. 2011 on the conceptual clarity of interprofessional interventions shares some examples of some of the different terminology you may see in this area. For example, interprofessional learning, interprofessional collaboration, multiprofessional training, transdisciplinary practice, and there's even more terms that could be used in this area that we're going to talk a little bit about in this video. I'll put some examples of what I initially thought of up here on the screen for you to see. And so all of these different terms to describe these interventions can lead to conceptual problems we see between interprofessional education and interprofessional practice or interprofessional collaboration. And this lack of clarity impedes the ability for us to develop a really robust evidence base for interprofessional education and practice. For example, what are the most effective strategies to inform decision-making by key stakeholders? For example, what are the most effective strategies for achieving our desired outcomes? And this is really important information to key stakeholders, such as educators like yourself, when you're trying to make evidence-informed decisions. For example, this makes things very difficult as educators when we are trying to decide what type of intervention we want to use to address an interprofessional issue that perhaps has arisen in our workplace, or even trying to find best practices, say, on simulation in obstetrics. It's difficult to not only develop that robust evidence base, but then for us to also find it as educators when we're all using completely different terminology and definitions. And a further reason why we can have these issues with conceptual clarity when we're looking at the relationship between interprofessional education and collaboration or practice is because the two are so closely intertwined. One of the ways we can understand this relationship is by considering interprofessional education and interprofessional collaboration as existing on a spectrum, with interprofessional interventions that are purely educational, say, on one end, and then having interventions that are purely looking at interprofessional collaboration on the other end of that spectrum. And I would say that this conceptualization is very well aligned with my own views on interprofessional education and practice, which is why we are going to be talking about interprofessional education and practice in our course, despite the course title only mentioning IPE. I personally don't think we can talk about one without the other. And we're going to talk further about interprofessional practice and education today. But first, let's start off by differentiating between the different terminology we may see popping up in the literature, such as interprofessional, interdisciplinary, multidisciplinary, etc. I generally like to start by talking about the difference between a professional and a discipline. So the definition of a profession can vary, and we're probably going to get into this more next week when we talk about theories and discourses. But generally, we can understand professions as being autonomous and self-regulated groups. So nursing, medicine, dentistry, social work, midwifery, occupational therapy, physiotherapy, dental hygienists, so on. However, in the literature, you will also see some articles that look a little bit more broadly here when they're talking about professionals, and they may include other groups that we constantly collaborate with in the delivery of healthcare services, like medical office assistants, unit clerks, and managers. I worked in family medicine for a couple of years, and I can absolutely attest that the medical office assistants we worked with were absolutely 100% a part of our interprofessional team. Now, disciplines are a little bit different. So disciplines are branches of knowledge or learning, so sociology, psychology, anthropology, computer sciences, and there can be some overlap here. For example, if we are talking about a teacher, we are talking about a professional, whereas education is a discipline. And sometimes within a profession, we can have specialized areas that are referred to as disciplines. So for example, you could feasibly talk about interdisciplinary collaboration between anesthetists and surgeons because they're different disciplines of knowledge within medicine. And now for the prefixes intra, inter, and multi. So my favorite way to visualize this is with Play-Doh. So with intra, we're talking one profession or discipline. So here we have one lonely lump of Play-Doh. In multi, we have two or more professions or disciplines, but they're in separate silos and they're not really touching. So there is some sort of shared experience when we're talking about multi, but there isn't a lot of interaction, there's no shared responsibility in decision making, so they really are learning or working in parallel when we use this prefix. And then in inter, we have two or more professions and disciplines who are squished together like this Play-Doh. So there's joint decision making, there's shared responsibility, accountability here, and as you can see, it is a lot messier. There's a lot of overlap, there's blurring of colors, and this is the type of thing we also see in interprofessional practice. And so we can go back here to our example of surgeons and anesthetists. So while we could potentially call them an interdisciplinary group, we wouldn't call them interprofessional because it is one professional group. So while they are multidisciplinary, they are intraprofessional. However, it could easily become an interprofessional group if we were talking about professional groups beyond medicine that could be involved in collaboration or education here. For example, an anesthesiology team could include other professions like nurse anesthetists, respiratory therapists, and of course, when we're looking at an OR environment, there are far more players, such as nurses in the operating room. So now that we have that out of the way, let's delve into interprofessional practice. So interprofessional practice is important because our patients and clients often require care for multiple health and social care professionals. And within healthcare, as professionals, you often don't work in total isolation. So interprofessional and even interdisciplinary practice is important because, as our reading by McMurtry and Kilgore point out this week, the world is complex, it's interconnected, and it's multifaceted. And a single profession or discipline doesn't hold the answers to the types of complex problems we're currently facing, ecological crises like global warming and even the current pandemic. So there is a need to work and learn interprofessionally. So interprofessional practice interventions can be understood to be activities or procedures incorporated into regular practice to improve collaboration and quality of care. And I have some examples here of interprofessional practice interventions. So a really good example of this would be interprofessional checklist. The surgical safety checklist is the one that always comes to my mind first here. Interprofessional meetings, rounds, communicative tools, briefings, forms, and pathways. And when we talk about interprofessional practice, there's a number of different terms you may hear being used in this area. Interprofessional collaboration and interprofessional teamwork probably being the most common ones you'll see in the literature. And sometimes these two terms are used interchangeably, but there are some meaningful differences here. So interprofessional teamwork refers to when different health and social care professions share a team identity and work closely together in an integrated and interdependent manner to solve problems and deliver services. So a really good example of this would be an operating room team, rapid response teams, potentially even a family health team. And some key dimensions of interprofessional teamwork include clear team goals, shared team identity, shared team commitment, role clarity, interdependence, and integration between team members. Now, this is a little bit different from interprofessional collaboration, although the two are similar. So interprofessional collaboration refers to when different health and social care professions regularly come together to solve problems or provide services. So here, when we're talking about interprofessional collaboration, we're talking about a much broader activity. So there isn't the same sense of a shared team identity, and while they are coming together regularly, they aren't working together in the same integrated and interdependent manner that you would see on an interprofessional team. And in our online discussions this week in my class, some of you have made some really interesting observations that these instances of teamwork where you have seen very positive examples of interprofessional practice have been cases of interprofessional teamwork, such as an interprofessional team coming together for a code blue. And next up is interprofessional education. So interprofessional education has become quite popular in recent years, but this idea of having different professional groups learning together is not new. And I love this comic that shows some of the different health and social faculties we often see on university campuses, such as medicine, paramedicine, pharmacy, lab sciences, physiotherapy, and nursing. And in the comic here, the patient's looking out of the hospital window and asks, how can they work together if they don't learn together? Which is a great question. So interprofessional education interventions can be broadly described as when two or more professions learn interactively to improve collaboration and the quality of care. So learning to work together is an important part of interprofessional education. And some articles describe IPE as being the first step towards developing those collaborative skills that are needed for interprofessional practice. So in terms of good definitions for IPE, many of you may be familiar with the CAPE definition of IPE. It's probably the one I see most commonly in the literature. So CAPE defines it as when two or more professionals learn with, from, and about each other to improve collaboration and the quality of care. And those of you in my class may have noticed that this is a bit different from the Van Hoof article we read this week. When we did this particular study, we did propose this CAPE definition as an option for the best published definition for IPE. However, our expert advisory board that was advising us on all of this actually didn't pick this one as the best published definition, and they actually selected one that was published in a 2013 systematic review. So in the systematic review, they defined interprofessional education as occurring when members of more than one health or social care, or both, profession learn interactively together for the explicit purpose of improving interprofessional collaboration or the health, well-being, or both, of patients and clients. And it, granted, has been a while since we did this study, but reflecting back, I believe the aspects that they really liked about this particular definition was that it explicitly mentioned both health and social care professionals right in the definition. I remember our expert advisors also really liked the emphasis on both health and well-being of patients. And now it's not as catchy as learning with, from, and about, but they preferred this definition. And I find sometimes when you're trying to determine whether something is an example of interprofessional education, sometimes it's helpful to take this definition and substitute interactively together with the with, from, and about definition. However, even with this definition, there were a few limitations that our expert pointed out with it. So the first thing that they highlighted to us was the importance of bringing in the different professions involved to planning the activity and the actual teaching experience. So let's say you are planning an interprofessional simulation for nursing, medicine, and respiratory therapists. Just one of these professional groups shouldn't be planning and delivering the whole simulation. There should be representation from all three of these professions in the planning and in the delivery of the simulation. And a second limitation they pointed out that we need to acknowledge, or at least keep in the back of our minds, is that our participants may be bringing back what they've learned to their own patient care team. So the IPE intervention may have been done in their workplace with their usual interprofessional practice team, but it could be something they're doing external to their workplace, like this course, for example, which they're going to be taking back to different patient care teams. And in this project, some key characteristics of interprofessional education that we identified were using an interprofessional team to develop the interprofessional activity, as we just discussed, as well as having an interprofessional team facilitating that activity. And I think also it's important to note how important the term facilitate is here. Within IPE, as educators, we're taking on more of a role of a facilitator. So we aren't coming into IPE with this usual idea of being content experts the way we may do in some of our more didactic teaching within our professions. So when we're engaged in IPE, we're stepping in as facilitators. And so we need to embrace the fact that there's going to be probably a bit of discomfort here and some degrees of uncertainty when we're facilitating IPE activities. The third key characteristic we found was using IPE throughout education, training, and practice. So it's really great to start IPE early in people's education, pre-licensure, so while they're still completing their training to be a nurse, dental hygienist, etc. And some older studies have actually found that as early as 2 months into their training, health profession students already have a very strong stereotypical notion about their own intended profession and where this sits within the social hierarchy of the other professions. So it's good to get them early. And of course, we can also do IPE throughout their training and their practice beyond, so we can do IPE post-licensure as well. So once someone has done all of their schooling and they're a licensed healthcare professional, or perhaps they are a medical resident, and this allows us to look more at workplace issues and their continuing professional development. And then the final key characteristic we identified for IPE was using IPE to address educational needs that are common to the professions involved in the activity. So we want to make sure whatever it is that we are doing the IPE on is something that's going to be relevant to everyone that we're involving in the activity. So with this in mind, some examples of IPE include seminars, workshops, courses, simulations, it's another very common example, placements and field work, and also certificate and diploma courses. And it's important to bear in mind with IPE that just because more than one professional group is involved doesn't necessarily mean that it's interprofessional education. For example, having learners from different professions in the same classroom receiving the same learning experience, such as a lecture, without that kind of reflective interaction among the learners in different professions isn't going to be an example of IPE. And this is because there isn't that interactive component where they're learning with, from, and about one another. So cases like this, I probably would call it more multiprofessional education. And I've been to a lot of interprofessional conferences that are like this, where they say they're interprofessional, but realistically it's just different professions and different disciplines sitting in the same room, listening to the same presentations, but not interacting. So this would also be an example of multi-professional education. And the same thing goes with things like bringing in a guest lecturer into a classroom. Even if they're from a different professional background, if we haven't incorporated that interactive with, from, and about kind of component, it may not actually be IPE. And something that's really fun about IPE, but also challenging, is that as learners and as educators, when we enter into interprofessional education, we are invited to leave our professional comfort zones. So when we're doing things in interprofessional education, we get to consider a variety of different biomedical, sociocultural, and experiential aspects of complex cases. And this can be really exciting, but it can also be really uncomfortable, both as learners and as educators. And in IPE, we're also bringing together a lot of different theories, a lot of different methodologies, worldviews, and that can also make IPE very challenging. And we're going to be discussing this more next week when we talk about theories and discourses, and again when we talk about barriers and conflict in interprofessional education and practice. And I feel like I have already been talking for far too long, so I'm going to end things off here by introducing the Canadian Interprofessional Health Collaborative's National Interprofessional Competency Framework. And I will link this as well as a quick reference guide to it down below in the video description for those who are interested. So this framework describes the competencies that are needed for effective interprofessional collaboration, and it describes 6 competency domains, including role clarification, team functioning, patient, client, family, or community-centered care, collaborative leadership, interprofessional communication, and interprofessional conflict resolution. And it also highlights some background considerations that may influence how the framework is applied. For example, the complexity. So for example, interprofessional collaboration could be more complex in more complex patient care situations. Contextual issues. So for example, interprofessional collaboration or teamwork in an emergency room versus in public health is going to look very different. And quality improvement. And as educators, we can use this framework as a starting point for our curriculum development if collaborative practice competencies are part of our learning outcome. And we are going to be revisiting this document throughout the semester, so hold on to it. And I'm going to wrap things up here. I hope this helped clarify some of the different IPE terminology that you're going to be seeing popping up in your discussions over the course of the semester. Of course, please do reach out if you have any questions or anything you'd like me to clarify or talk about a little bit further. And as always, I will see you all online. Bye.